Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. I'm Brittany Schaefer. Today we talk about why women are more susceptible to ACL injuries.
We've known about this for a number of years, for probably about 20 years now, that this has been noticed through lots of studies. Lots of research has been done on this topic, and we don't know exactly why it's going on. Different facets of the women's anatomy compared to men's, other things about women compared to men, and the only thing that's been determined to be different a little bit is the way the muscles are activated in the legs with certain cutting and jumping activities.
What causes an ACL injury?
First of all, your anterior cruciate ligament is a ligament in your knee that helps to give stability to the knee. The way you injure your ACL is usually with a cutting or twisting or pivoting maneuver or coming down from a jump awkwardly, and that overstrains the ligament and it tears.
Do particular activities or sports have more ACL injuries than others?
Probably the sports and activities that have the most ACL injuries are things that involve twisting and cutting and pivoting, such as soccer, volleyball, basketball, dance activities, things like that.
Is there a difference in the anatomy of a woman that causes a higher number of ACL injuries?
Basically, women have been found to be more susceptible to ACL injuries because of the biomechanics of how they fire their muscles and how they land from jumps, with their knees more angulated than men, and the way they fire their quadriceps more than their hamstrings. There's no reason that's been proven why men and women are different with that, but there is a difference. Studies have been looked at with anatomy, the size of the ACL, the different aspects of the knee joint, the menstrual cycle and how that might factor in, and nothing has definitely been proven other than the biomechanics of the muscle activation and landing patterns.
What is the best way to prevent ACL injuries?
The best thing that's been proven to help avoid ACL injuries, and it has been proven with studies, is conditioning and balance training and strengthening exercises specific to try to help avoid some of those altered activation patterns and landing abilities.
What are the treatment options for ACL injuries?
If someone presents with an ACL injury, it's a difficult situation and difficult conversation with the patient and her parents, because oftentimes they need to have surgery. The ACL doesn't heal on its own, and so bracing and physical therapy alone usually will not help an active young athlete to get back to their activities. Usually surgery is required. Usually you have to reconstruct the ligament with some kind of tissue, either the patient's own tissue or someone who died and donated their tissue. There's lots of different options to reconstruct the ligament.
Does overuse contribute to more ACL injuries?
I think that overuse isn't necessarily a problem with this compared to some tendinitis or stress reaction type injuries, but the more exposure you have to a sport, the more practices and games and playing year-round, that can affect the number of opportunities you have to tear your ACL.